the outlet was right behind.
I think
Yeah,
I'm
right
gonna,
back there.
I think I'll survive, but
Okay.
yeah, let's do it.
Yes, sir. Yeah, we don't have the greatest of equipment, so don't judge. Our crutches are kind of falling apart right now.
Okay, so we're going to play out two different scenarios for you, one in the hospital, one in outpatient. And we're just going to teach you guys how to properly fit and train somebody to walk with an assistive device. Mainly just a walker and crutches. We're not gonna do anything.
Oh,
We're also going to go over two different weight bearing statuses because it's something we also deal with. So first one is going to be non-weight bearing, so they can't put any weight at all in that leg. Like that. Alrighty, so the first thing we're going to do is teach them how to safely stand up from a surface with an assistive device. So we usually always, it depends on patient population, but we usually always start with the walker because it's the safest. And then if they do really well, we transition to crutches. And so what we would tell a patient is we want this close to them, their leg that they're not putting weight on, so we'll say it's their right leg, to stick it out. And then what we want them to do is we want them to push both hands up from the bed to stand up. And then once they get to standing, they can transition their arms to the walker. So a lot of people like to try to stand up, starting with both hands on the walker, and it tips back. So it's super unsafe. So we always teach them, yes, always push both hands up from the bed. And then once you get there. And so this walker is a little low for him. And so how we kind of determine the appropriate height is if they have their arms relaxed beside them. So we want the arm rest, we want the hand rest here to be at their wrist. So when they go to push, they're at approximately a 30-degree, give or take angle. And that gives them a lot of leverage to push through their arms. And then walking forward, what we would have them do is we would have them push the walker forward just a little bit, and then pushing down through both their arms and their good leg, they'll hop forward. And then push it.
Oh, keep going, okay.
Yeah. Big things that we also look out for is how close they stand to the front of this walker. So whether you're putting the weight or not, a lot of people either like to put it way too far out in front of them, not safe, or they do the opposite of they just stand really, really close to us. Yeah. And a lot of patients, we either have to retrain them how to use an assist device, or they've never used one before. So it's brand new for them. And then for walking backwards, we usually have them, it's just the opposite of forward. So you're gonna push down through both your arms and your left leg and hop backwards, and then bring the walker back. And then for turning, especially whether they're full weight bearing or non-weight bearing, we always want them turning towards their strong side. So in this case, if he's not allowed to put any weight on his right leg, we'll have him start to turn the walker towards his left, and then pushing down through his arms and his left leg will make his turns. So we never want him turning towards the side that he's not putting weight on, because it's just not as stable and not as safe.
There's a high tendency when you turn this way for someone to do one of these, like to, if they lose their balance, that one will go down. If they lose their balance this way, it's much easier because it's a little more central to your walker.
And that is a walker.
do you have any questions?
What do you do with a patient who maybe they're really big and they have to walk but they can't like kind of hop on one foot? Does that make sense? Do you ever run into problems with that?
Yes. A lot. They do not look very far. Yeah, so we've tried with walkers, and sometimes if it's just not safe, we don't do that. So depending on their injury and stuff, we have tried other assistive devices like a knee scooter, or we just like transfer over to a wheelchair at that point.
So yeah, it's really important too that you have the correct size of the walker, because if they are a larger person, this may not be appropriate for them, and they would need a bariatric walker, which is bigger, which is going to withstand their weight. And usually you're going to screen their lower extremity and upper extremity, so you would need to see if they're strong enough even to stand up out of bed, because if this is a hospital setting, we're going to be usually the first people to get them up out of bed if it's after a surgery. and screen their upper extremities as well to make sure that they can hold their own weight if they have to push it out their walker.
And
So-
usually, because I know I've come to encounter not necessarily bariatric, but new amputees have a really hard time just hopping on one leg. So we usually just do edge of bed stuff, and so we work on just hopping in place in the walker. And then once we get that down, then we teach them like energy techniques, because a lot of times it's just they're using way too much energy. And so once we're safe doing it edge of bed, then we try taking a couple steps, and then eventually transferring to walking. So we don't really have the expectation that they'll walk the first time we sit down, or hop, per se. For that.
Would you be using a gait belt with this patient?
Yes,
Yes.
we would have a gait belt on everybody.
Oh no, for sure. We
yes.
just forgot it. It's in our, we forgot to grab it before we started. So.
And we always educate nursing, especially in the hospital, if you're gonna get a patient out to put the gait belt on them. Also with this too, we also have to teach patients the walkers that have wheels on them, they can just push it like a grocery cart. So a lot of people just wanna pick it up, and that just takes more energy than just pushing it. And then crutches, it's pretty similar to a walker, except it's just a little bit more unstable because you only have 2 points of contact on the floor instead of 4. And so the fitting is gonna be the same, but instead of the handle of the walker, the handle of the crutch, we want it to be at about the crease of their wrist there. And then usually we'll have them stand up first when we fit them, and we want 3 fingers, your 3 fingers from this to the top of their armpits.
Yeah,
Is
the crutches
appropriate
aren't,
there.
so like these on me would be way too tall,
Yeah.
or even on Becca. This is being shoved up into my armpit or axilla, and you have a lot of important structures in there that you don't want to damage. So you want to make sure, like you said, that it's nice and low so that it's kind of right at the side of your knee.
Which we'll show in turn too. And then when we have them stand up with crutches, we usually always have it on their stronger side. So both of the crutches are gonna be together. And what he's gonna do is he's gonna place his hand on the inside there. And then pushing down through this hand, his other hand and his strong foot, he's gonna stand up. We're guarding the whole time. And then we'll transfer one of the crutches over to his weak leg. Just like that. I know it looks a lot easier than it probably really is. And then making sure here that you have 3 fingers, approximately 30-degree angle here, and that. So a lot of times you can't just trust the patient when they tell you how tall they are, because it's not gonna appropriately fit them.
Something I ran into a lot is the difference between an elderly patient, not necessarily in crutches, but in all assisted devices. I know their height, and these sometimes have a height written on them. You're like, let's try that, and then they walk like this. So at that point, you gotta assess: A, can I tell them to stand up and have better posture while they're doing this? B, can they maintain it? So if they're unable to maintain it, typically what I do is I find a happy middle ground of, obviously I'm cueing to try to get better posture, but I don't want them to have better posture and then be down here. At the same time as I don't want them to have really poor posture and have their super tiny crutches or a really short walker. Because, I mean, they'll just end up using a lot more energy for push off. If it's too short, they could damage any structures in their armpit, or they could end up like just decreasing mobility if it's too tall.
So along the same lines with the walker, it always goes assisted device and then bad foot, good foot, or in this case, we can demonstrate what partial weight bearing is. So partial weight bearing is about 50% of your body weight. So let's say if this was an outpatient clinic and I get the orders from the doctor saying that they're allowed to change weight bearing status, but I'm the one to educate the patient. A good way that we've been taught is that you could get a scale, because most facilities now have to have a scale, and you can know what their body weight is, and then you can have them stand on the scale and figure out what that 50% feels like, which is something I didn't learn until PT school. That's a very easy way to kind of get the patient to know what 50% body weight is if you don't want them to break that precaution. So for Jim, let's say we already went through that. So it's going to be the exact same thing. So it's going to be crutches first, and then bad foot, so because he can now put weight for it, and then step in with the good. So then crutches, bad foot, good, and then it's going to go the exact same way going back. So you're going to step back with your bad leg, or good leg, sorry. Good leg, bad leg, crutches. Good. Good?
I was like, what are
Bad?
you saying?
Crutch. Okay. Obviously, it's, the training gets easier. And then same thing with turning, it's gonna be always towards your good side, so same thing, so it's gonna be crutches, and then you can just go ahead and mount. Or you can put the body weight through it if you need
Or just like we saw, it could be
to. Just
hop
hop around,
around.
whatever they feel the most comfortable with.
Turn this way,
And then same thing with cane. You would measure it to their wrist. In the hospital setting, if I felt like an elderly patient did fine with a walker, I would generally just move to a cane. Crutches were a little bit too hard if somebody was coming off a joint replacement, for them to try to figure out crutches. A cane worked just fine for those patients. In a younger population, just like us, we would typically move into crutches. And then, do you want to show stairs real quick with the crutches? Okay, so we'll have you go over. Yeah, so there's a variety of different ways. PTs are known for being very creative. So one of the things that we have to do in the hospital is make sure that you can get home safely, and a lot of people have stairs to get inside. So we have to make sure we can clear you on stairs before you go home. To use the stairs in the hospital, it's really not safe to go home. So we might have to find different alternatives. But let's say Jim has all of these stairs to get into his house, and the handrail going up is on the right. So there's a couple of different ways. He can use one handrail, no crutches. He can use the two crutches on this side. He can take the crutch, put it on one handrail. He can chuck both crutches up the stairs. If he doesn't feel comfortable, he could like scoot up on his butt backwards. So there's a lot of different ways depending on how the patient feels that they can go ahead and do this. Since he has bigger hands than I would, I think he's pretty safe if we put both the crutches underneath this arm. Go ahead and transfer this one over. Good. So then what you're gonna do is you're gonna put one hand on the handrail and then one hand down through the crutches. And if for some reason there are two handrails, use both of those because those are more stable than your crutch or walker or cane or anything like that. So definitely if there's two handrails and you can touch them at the same time because sometimes they're too far apart, definitely use those. So what you're gonna do you wanna do partial or non?
It's up to you. Let's do both. Do both like that.
Just do partial. Okay, so it's always up with the good, down with the bad. I'm sure like everybody's heard. So you're gonna leave the crutches down here. So what you're gonna do, Jim, is you're going to push down and bring that good foot up. Good, and then go ahead and push up, stand up. Good. So go ahead, good, push up, good. And then when you get to the top, you're gonna turn towards the handrail. Even though it's backwards, it's just the most stable thing at the top for here. And he's gonna transfer it. So now you're gonna lead with your bad foot. So you're gonna push down through so you're actually gonna bring these down to this stair. So bring your crutch down, good. Bad foot, good foot, good. And then crutch, bad, good. Crutch, bad, good. Crutch, bad, good. So yeah, that's a very fast demonstration of stairs, which are very important.
And then the locker, we usually just, we'll put the locker here. And then so that will kind of be their crutch. And then it'd be the same thing, so I'll look good.
Yeah, we've talked about this when we were trying to figure out our demonstration, how creative we had gotten to get somebody up the stairs. I know my CI, or clinical instructor, she would keep the front legs to the walker short and keep the back ones long, so you could actually put it on a stair so that they could get up into their house, because people don't want to be in the hospital for days on end, so if you can figure out a way to get them home, or doing it Jim talked about sometimes doing it sideways, because it can stabilize like this. Having it somebody that's going to be staying with you at home, you can do a handhold assist so they could become your cane or walker. If you don't have a handrail too, so that's also challenging if you have no handrail and 10 steps to get into your house.
usually do a lot of family training too, especially before they leave, whoever's gonna be with them at home, to do stairs with them, to make sure that they're safe.
Very brief demonstration.
It's great.
Does anybody have any questions about any of this? Yeah, a lot of different assisted devices, different ways to navigate in different weight bearing statuses that kind of all play along, because last thing you need to do is make somebody angry because they break their precautions.
Let's get some people trying it. Let's get some people trying it.
Sure, yeah, we can go grab some walkers and I can grab a few sets of crutches, yeah.
Great.
So yeah, come on up. Or you can even try like just the stairs, figuring out like the step 2 pattern, or figuring out how to get up on one leg.
I want to try up with the good, down with the bad.
Which is a good advice. That's all you. Longer than mine?
So yeah, we have a few more sets of crutches. Oh, we do have 2.
Here's a standard walker tube, so if anyone wants to feel the difference of how much more effort it takes to pick up a walker than to push it. So this would be super tall for you.
Yeah.
So if you like relax with your arms by
Well,
your
there's-
side, you want this to be at about your wrist, so.
Alright, and then we have a standard just wooden cane. You could also see these in metal. You could adjust it just like